Good evening, everyone, and thank you for joining us. Before we get started, I just wanted to share a few brief housekeeping announcements. First, we would like to thank everyone who submitted questions in advance of tonight's town hall. We hope to address many of your COVID-19 vaccine questions over the next couple minutes and next hour with our panelists. If you have additional questions or need any clarification, please use the Q&A function in Zoom. And as a reminder, this is a public forum, so anything you type will be visible to others. Tonight's town hall is being recorded and streamed live on Montgomery County's social media platforms. Please feel free to share the link so that others can tune in. And finally, a recording of tonight's event will be made available on the Montgomery County YouTube, Facebook, and Twitter pages so that everyone can watch that there. And now I will turn it over to tonight's moderator, Angie Hinton.
Thank you so much. Good evening, everyone. My name is Angie Hinton. I am the president of the Norristown N.A.A.C.P. And I want to welcome you to this conversation tonight regarding the COVID-19 vaccines virtual conversation. It seems weird. It's COVID-19, it's 2022, and we're still talking about this. So it's still here. And so we want to have a conversation and just provide latest information and just provide an opportunity for you to ask questions. And again, just be updated on kind of where we are. And so I want to introduce or allow, I guess we have some lovely doctors here tonight, and I want to provide them with an opportunity. I want to thank you for joining us, first of all. And then I want to provide an opportunity for them to introduce themselves. So I will start with Dr. Lee. If you could just provide a brief introduction of yourself.
Absolutely. Good evening, everyone. It's a pleasure for me to be here. Thank you for having me. My name is Tosha Lee, and I am the Associate Medical Director at Norristown Regional Health Center in Norristown. I'm also a family nurse practitioner and have been practicing as a nurse practitioner for 5 years. Have many years of experience as a labor and delivery nurse and lactation consultant as well. And it's my pleasure to be here to talk about COVID-19, the vaccines, and how we can best protect our communities. Thank you.
Thank you so much. Thank you. Dr. Smith-Benjamin, if you can introduce yourself briefly as well.
Hi, everyone. My name is Sarah Smith-Benjamin. I am a family physician. I actually work around the corner from where Dr. Lee is at Montgomery Family Practice, which is a family practice residency practice that is associated with Einstein Montgomery Hospital. I am a family physician, and I also practice family medicine obstetrics. So I take care of children to age 99 to 100. So I'm really excited to get to talk to my community and answer questions that people have about the vaccine.
Thank you so much. Yes. And so again, it's very important for us to have this conversation. We know there's been a lot of confusion and misconceptions about, COVID, especially in communities of color. And so I think it's really important for us to come together and really talk about it and deliver information to our community from our community, members of our community. And so I guess we'll start off with Dr. Lee and just ask you, what are the current recommendations for the COVID-19 vaccines and the booster?
So right now it is recommended that anyone age 5 and up receive a COVID vaccine, and just about anyone can receive a COVID vaccine. There's very few who can, and usually those are people who are allergic to the vaccine itself or a portion of the vaccine. So if you are aged 5 to 11, you would receive 2 doses of a COVID vaccine. If you are 12 and up, it is recommended that you receive the initial series, which is 2 doses and a booster. And then if you're age 50 and up, or you have certain medical conditions, it is recommended that you receive the initial series and then 2 boosters. So how many doses you require really depend on several things, which of course you should discuss with your primary care provider. But for the most part, we can say almost everyone over the age of 5 should receive a COVID-19 vaccine.
Thank you. And you mentioned it could depend on multiple things. So I know I have a mom with some additional, she's additionally compromised. So situations like that, it could be where they need more doses than, people who are younger and more healthy, correct?
Absolutely. It's age, it's medical condition, and even the type of vaccine as well, because the recommendations for Johnson & Johnson are a little bit different from Moderna and Pfizer.
Thank you for clarifying that. Dr. Smith-Benjamin, can you talk a little bit about what the side effects are from the COVID-19 vaccines?
Yes, so the side effects overall are pretty mild and pretty self-limiting and remain within a small amount of time. Most of people have some soreness at the injection site, on the arm, and fever, chills, body aches, fatigue, nausea. Those are the most common symptoms that people have, anywhere from 12, 24 to 48 hours after vaccination, more common with the second vaccination or the third vaccination of the mRNA vaccinations. Not everybody has these side effects. And if people don't have the side effects, that does not necessarily mean that the vaccine is not working for people. They still have a good immune response. But most people have some symptoms, they kind of go away on their own. There are obviously rare side effects that people are worried about, and I think we'll talk about them a little later, but myocarditis is one that people have been concerned about, and that has been sort of public in the news. And I just was going to pull up some sort of data and some information, but essentially the risk of having myocarditis with the COVID mRNA vaccination is very low, and actually even lower than the risk of having myocarditis with a COVID-19 infection. And it's about 4 people per 1 million, specifically within a population of men from 18 to 24. So other than that, most people have the mild symptoms that I talked about before.
And it's normal if one person's reaction is a little bit different than another person's, right?
Exactly. Yes. Everybody has a little bit of a different reaction. Everybody's body's immune system reacts in a different way. We know that there's some people who get the tetanus shot and have a really sore arm. Some people who feel like they don't really feel anything, a little bit different for each person.
Perfect. Thank you so much. Dr. Lee, I get this question all the time because I work with young people, in particular, young women. So can the COVID-19 vaccine affect puberty or future fertility in children?
The COVID-19 vaccine does not affect fertility. It does not affect puberty. It does not affect growth. And as a matter of fact, specifically talking about fertility, studies have been done looking at pregnancy rates between women who've had the COVID-19 vaccine, the COVID-19 infection, and then women who've had no vaccine and no infection, and there are no difference in those pregnancy rates. So the COVID-19 vaccine does not affect puberty nor fertility, nor does any other vaccine for that matter.
Thank you. I get that question a lot, where a lot of the young ladies that I work with were a little hesitant initially because of that, which is smart for them to think about it, but I'm glad that the science, has an answer for them. Dr. Smith-Benjamin, why are booster doses recommended?
Yeah, so that's a great question. And I think that it speaks a little bit to how the COVID pandemic evolves over time, and how our research and our information evolves over time. I think even though this pandemic has been really difficult for a lot of people and has caused a lot of problems, seeing new technology and new science come to the forefront has been something that's been really interesting and exciting to see, that we are using our medicine to change things and make health changes for people in a very quick time. So sometimes then our information lags a little behind what's going on, and we kind of have to catch up and get more information over time in order to give the best vaccine and best treatment. So as we've been in the pandemic for longer, we've had more time to study how people's antibody levels are reacting to different variants over different amounts of time. The different variants part is probably one of the bigger reasons why we had the need for booster vaccines or booster doses, because as the variants of COVID become a little more and more different from each other and become better at evading our immune system, they become more infectious, which is sort of their job, and they're not as caught by the antibodies that we produce by the vaccine. the more antibodies you have, often, the more likely you are to neutralize or stop a virus that's a little bit different than the original virus or original COVID virus that you were vaccinated for. The other part is that antibodies sort of wane over time, and in about 6 to 8 months after being vaccinated, people's antibody levels will drop. In order to keep your antibody levels high enough to fight off the original COVID variant, as well as the other new variants that come out, you need an extra dose or a booster to boost your immune levels.
Thank you. Thank you for that answer, because I think it's important. I hear people all the time that, are express concerns or, just disbelief in the whole process because they say, oh, things are changing all the time. So I think it's important to really think about the fact that as we learn more, right, or as things evolve, then the recommendations and the requirement for boosters may change. And so I'm really glad we talked about that, because I think that's something that comes up a lot in conversations I have had.
It's very true, because I think I wouldn't want everything to all our recommendations to stay from March 2020. We would still be washing all of our fruit. We'd still be taking our clothes off, when we get to our stoop before we go into the house. And we just know more now. So, that's the important part about science, is that it changes and adapts. Not that it was lying before, but that we get more information and we add that information to what we already have. We just haven't really figured out exactly what's the most optimal number of vaccines, what's the most optimal booster. The most important thing is that we know that everything is safe, and we're just trying to figure out what the ideal situation will be.
Yeah, it's similar to like cancer or giving birth, right? Like we learn more things. And so we're able to treat things more precise, right? Like we're able to have people live longer with diseases that they died from years ago, right? So you're constantly evolving, learning more. And so recommendations will change as we learn more. So I try to, help people think about it that way, but I'm just glad we talked about it, because I think it's important to restate that. Dr. Lee, so we talked a little bit about, pregnant women, or will this harm people from a fertility perspective, but are the vaccines safe for actually people who are pregnant or people that are like right now thinking about becoming pregnant?
That's a good question. And absolutely, the vaccine is safe for pregnant women and for people who are considering getting pregnant. And it's a good question because when the original vaccine studies were done, pregnant women were not included. However, we've made quite a few vaccines available to pregnant women in the past. As Dr. Smith-Benjamin just said, it was a matter of getting the information over time. And so now with the time that has gone by, we do know that it's safe for pregnant women. It is recommended by all of the healthcare professionals. And it also is a good way to protect the baby that is about to come. So it is a good idea for people who are either pregnant or considering getting pregnant to get the vaccine and add that layer of protection in the house.
Can I also add to that too? Can you talk a little bit about the dangers of getting COVID, like comparatively, right? Like having the vaccine versus actually not being vaccinated and getting COVID, and how that can impact someone being pregnant or the baby?
Absolutely. So pregnant women do have a higher risk of having complications from COVID if they get COVID during the pregnancy. And so by getting the vaccine and protecting themselves from COVID, they are protecting their overall health. And really any illness in a pregnant woman that causes fever, dehydration, that is serious for the pregnancy and can have, some outcomes on that fetus. So we really do want to protect that pregnant mom, keep her as healthy as possible, and reduce her risk of having complications while she's pregnant. And this wasn't part of the question, but I might as well just add, it's safe if you're breastfeeding as well. And if you're breastfeeding and you get the vaccine and you have these antibodies protecting you from COVID, your baby is getting those antibodies as well. So not only are you protecting yourself and indirectly protecting your baby from getting COVID, but now you're passing these antibodies on to your baby through the breast milk, which is also protecting your baby. And as we know right now, although that might change and we'll talk about it later, but this age group is not getting vaccinated right now. So this is the best way to protect those little ones.
Thank you so much for bringing that up. I think that's very important. Dr. Smith-Benjamin, there were many lessons learned from COVID-19, but I'm really interested to hear your perspective on COVID-19 vaccine equity and, what we could do to improve the vaccine equity.
Yeah, I mean, I think this is a really important question, and this is a really important thing that the pandemic has brought to light, the inequitable, I think, overall healthcare and health treatment of many people in this country, and it's something that needs to be addressed. Practicing an equitable medicine during a pandemic especially leads to worse disease and outcome for everybody. So it's in all of our best interests always to take care of everybody equitably in our country, in our county, but it's really important during a pandemic. The WHO, or the World Health Organization, also obviously feels very strongly on vaccine and health equity, and discuss that the more people who are vaccinated, the less virus is going to spread and mutate, which is where the problem is, and less new variants that are going to cause more harm. So the WHO wanted all of the different countries to vaccinate at least 10% of their population. And there were a lot of countries that were really not able to do this because they weren't able to get vaccines. That led to sort of what we call a failure of global vaccine equity. And I share this because we sometimes see this similarity within our own country, that while America had a very large share of all of the vaccines that other countries didn't even have the access to, there are more Americans who died from COVID-19 during this pandemic than any other large wealthy nation. Very large amount of people who died, which is really not good and unacceptable. And we know people who are low income are among some of the more highest rates of unvaccinated people and have higher rates of COVID-19 infections, as well as serious infections and complications from COVID due to some of their other underlying illnesses. So we have people who might have not been able to have stop their job, work from home, who've been frontline workers since March 2020, who might have pre-existing conditions, who potentially were at risk for contracting COVID, for having complications and spreading it to their family. So I think this is something that's really important that's been brought to light, and that we need to more equitably distribute vaccinations across the country and across the world. So equitable distribution of vaccines doesn't mean that everybody has equal access to it, but that actually people who are at higher risk of having complications, higher risk of having some medical conditions or poor outcomes would have increased access. And we started to do some of that. And I think the area of Montgomery County and Philadelphia have been working very hard to do this, which has been very heartening for me, that we were really trying to get in all the communities and get vaccines to be easily accessible for people, and in a place where people felt like they were being given by people they could trust. Because I think, as we talked about this a little bit, there's a lot of distrust, from the rollout of the vaccine, from the rollout of many of the measures of the pandemic, due to a lot of different confusing things and some political sort of involvement that made it really hard. So I think making sure that vaccines are available in communities, an easy walking distance by people like their primary doctors or people who are right around the corner, is one of the most important parts, as well as having people have somebody who they feel comfortable talking to, sharing their fears about vaccines and hesitancy, and having these frank discussions about what to expect, about safety, and helping empower people to make the proper decisions. So I'm hoping that, by having a more grassroots, community-based approach to public health, that can really help. And I think, Montgomery County and Pennsylvania or Philadelphia, the ones I know the best, have been doing a good job. So it's been really great to see.
Yeah, I think the mistrust is a big problem, right, with regards to who will be interested, right, in getting the vaccine. I think the overarching problem in this country and other countries with inequitable access to healthcare, right, leads people to think maybe they can't get the vaccine. So we want to state tonight that these vaccines are free, right, for people, whether you have health insurance or not, right? And so, and then I would like you to just restate one more time, because I think it's very, very important for people to understand that the mutation comes from, when we hear people, concerned about variants, right? That comes from, people not being vaccinated. So if you could just state that one more time for the people in the back, I'd appreciate it.
Right. It's so true. It's almost like COVID is playing a game of telephone with us, where every time it gets whispered to the next person, it changes just a little bit. And you go from, I just had ice cream, to the bus is on fire. And we have a completely different sentence. And those two sentences are two different things that might be very hard for the vaccine to tackle themselves. And that's where we get really scared. And that's where we get worried, right? We saw the original, I like to, colloquially call my original strain of COVID the OG COVID strain, right? So OG COVID came out, we got our vaccines, we were all really excited. We saw a very big drop in transmission, hospitalizations, cases, and deaths. But it didn't happen fast enough for some of the reasons that we were talking about. And because of that, the changes, the mutations that happened led it to escape the vaccines. And so the less vaccine escape there is, the more people are vaccinated. The buck would stop at one person who was vaccinated. The virus wouldn't be able to travel or mutate any further, and we might not have a variant. Obviously, that's optimism, but that's kind of the thought that the less people who could get this and spread it to people, the less likely we are to have dangerous variants that could be really harmful.
So important for people to hear that message. So thank you. Dr. Lee, so we're talking a little bit about mistrust. Community engagement, right, is critical to overcoming mistrust and building confidence in the vaccines. So can you speak to strategies to combat mistrust and build confidence in COVID-19 vaccines with communities of color? I mean, I personally have heard some, really just out there, right? People really believe in our community. And so if you can speak a little bit to that, I think that's important.
Absolutely. So there is a lot of mistrust out there, and for very good reason. There is a lot of history within healthcare of communities, people of color not being treated well. Currently, there's issues in healthcare where people of color and other vulnerable groups just don't have the same outcomes that other people have in healthcare. And then there's all the other things that are going on in the country outside of healthcare with systemic racism and injustice, inequity, so forth and so on. So there is a real reason why there is a lack of trust. So, the first thing we have to do is to acknowledge that. And then after that is to get to the heart of what we really have to do. And so it's important to get factual information out there, to go where the people are, to talk about what we're trying to do, what the goals are, how we can stay healthy, get rid of all the myths, get rid of all the misinformation, teach people where they can go to get factual information, where they can go to get care, and then, have people of color and minorities sharing this information. That's why I do what I do, and that's why Dr. Smith Benjamin is here, and so many other organizations and healthcare providers and public health officials of all different races and ethnic groups, just kind of getting out there to say, we're all in this together. This is not an issue of, different groups having, different situations. We're all in this together. And the fact of the matter is, as we know, that people of color were affected more, than white people and the majority. We were affected more with COVID rates and COVID complications. So that's how we're going to get through this, is to get the right information out there and to get the healthcare that everyone needs right at their feet.
I think it's really important to talk about that, because I know I was working with predominantly, my team was white, And the amount of COVID incidents that were happening to me and people I knew were far outweighed anything that my colleagues were experiencing. And so, I think it's important for people to understand that. And a lot of it has to do with the mistrust. And it is legitimate that people feel that way. But the consequences of that are that our communities are impacted at a much greater level. And so I just hope people take that away and understand why, it's important that, and I'm so grateful for you coming to have these conversations because hopefully, having people that, people in our community can trust, right, will maybe make them more likely or open to listening and taking in the information. So thank you for that. Dr. Smith-Benjamin, back to you. Why is health equity, which I know you have talked about is important, why is it crucial to preventing the next pandemic?
Yeah. So, I think we talked a little bit about it. I think overall health equity would make such a big improvement and positive change for our country as a whole and the health of our country as a whole. But equitable distribution of vaccines, life-saving treatments, and illness prevention are going to help prevent and curb the next pandemic. I also think that, like we were talking before, having an equitable distribution of vaccines and health equity approach to the pandemic is going to give some people that foundation of trust that they have with maybe their provider, their community health workers, that is going to help carry us into the next pandemic. And maybe we will be able to overcome some of those initial fears and concerns because we've already laid that groundwork. So having an equitable health approach, I think, helps your patients or our patients and people in the community having a better health outcomes and, better trust, which is definitely important. We need to, earn people's trust. So we're all susceptible to the virus. Taking care of everybody is really important. And making sure the people who are most at risk are getting care is very crucial.
Mm-hmm. So crucial. Dr. Lee, can you share a little bit about what your organization is doing to engage the community on the vaccines? And just would love to hear if you are having like specific outreach engagement with Black, Latinx, women of color, queer communities of color, is it really targeted? How are you approaching that?
So I specifically work for a federally qualified health center, and our main population does consist of people of color, Black, Latinx, women, immigrants, you name it, and we are caring for this group of people. So we have definitely tried to reach out and engage as much as we could. We have been offering and continue to offer COVID vaccines in our clinic, and not just to our patients. Anyone who comes to our office for a vaccine will get it, regardless of insurance, ability to pay. As Angie mentioned in the beginning, these vaccines are free. It doesn't matter. We will take you. It doesn't matter if you're not our patient, if you have insurance and we're not your PCP, none of those things matter. You can come and you can get that vaccine. We have partnered with our communities, and my organization is not just in Montgomery County, but tonight, I'm going to touch just on Montgomery County. But we've been working with our local health departments, with the schools, with the churches, wherever the people are that we could go. We have done vaccine clinics in so many different locations throughout the community, not just within our organization. We have been going to the home for people who are homebound and are not able to come into our office. We've done some vaccine clinics at the schools. We've partnered with the county so that they can have their a testing location in our parking lot. Dr. Smith-Benjamin talked about this earlier. It's important to have a place where people can get to easily, where they can walk to, where they don't need public transportation or a car. So we've really tried to partner with as many people as we could that was within our reach to affect as many people as possible.
That's so I have used your testing facility myself. So thank you. And I do think it's important that we talk about that, because I think a lot of times, whoever it is, doctors, government, right? Like not failing to meet people where they are is a big problem. And so you doing the kind of outreach you've done and really trying to be intentional about meeting people where they are is key to, being successful in many things, whether it's, civic engagement either, right? Like everything, we have to really rethink about how we can outreach to people and meet them, where they're comfortable, where they feel safe, places they trust. So that's so important. So thank you for all that work. Again, thank you for that clinic, because I have gotten tested there myself. And so I appreciate that so much.
Angie, I just need to be clear. The testing site actually belongs to the county, to the health department. We're just providing some space.
Yeah, no, but I mean, so thank you for that. And I do appreciate the county, even events like this. They have been working very hard, not just with the Black community, but with, just again, trying to meet all communities where they are. And so, initially it was tough, right? But I do think there has been a really concerted effort and a continuous effort to try to find new ways to engage people in a way that people will find engaging, right? And so thank you to the county. Shout out to the county too. I appreciate all of this work and the partnership. Dr. Smith Benjamin, coming back to you. This is a question again, that I hear a lot of times. Oh, people, they don't know what they're talking about, right? Like it changes all the time. So how long do the antibodies last in your system after getting COVID-19 with all 3 shots, and are you protected from the virus?
Yes. So this is obviously some other information that we are, that's slowly kind of coming out. If somebody has COVID, how long are you protected? Do you need the vaccine? When should you get the vaccine? They did some studies where they looked at people who were vaccinated against COVID, who recovered from COVID, and then sort of followed them. Their rate of reinfection was similar for 6 months to about a year. And then after that 1 year, the possibility of becoming reinfected with COVID was a lot higher in people who had only been infected with COVID. Then they took people who were infected with COVID-19 and gave them 1 shot of an mRNA vaccination, and actually saw similar vaccine effectiveness in immune protection as people who had had 2 shots and never had COVID. So with all 3 shots, you are pretty protected against the original COVID strain, the Delta COVID strain. Unfortunately, the Omicron COVID strain really escaped our vaccines, and the antibodies that people had from vaccine alone didn't really neutralize Omicron beyond about 2 months. So it's hard to say, when we ask the question, are you protected from the virus? Exactly which virus are we talking about? Exactly for how long? The most important thing I think that sometimes is we forget about when we're just trying to see if people are getting infected or not, is that even though the effectiveness of the vaccines might have decreased, they still were very good at preventing people from being hospitalized or dying from COVID, which is a really important part. Having a cold, being sick is obviously something that now is a lot more scary than it used to be, and means a lot more. I'm honestly shocked that we all used to go to work with colds and tissues and sick and feeling really crummy all day. And so it's a little different now, but there's some benefit to maybe having a COVID infection and then a vaccination, but that assumes that the person who had the COVID-19 infection is going to be fine and recover completely, which is really never a given. So I would probably choose the 3 shots myself. And for the most part, having 3 vaccines protects you against the original strain of COVID, protects you from the Delta strain of COVID, and somewhat protects you from contracting Omicron, but definitely protects you from hospitalization and death.
Mm-hmm. And I think that is something people forget all the time, right? The difference today, right? Like now I hear people say, oh, it's just like a cold. And I'm like, Well, because of the vaccines, right? Like that is why previously, if you look back to when this first happened and we couldn't leave our houses, right? People were dying at unbelievable rates. And so, sometimes we move on so fast and we just forget that. And so I think that's very important to restate that, and for people to take a look back at that and understand the difference and what has caused that difference, right? And so, but I just think that's so important.
Yeah, very true.
So here comes the big question, Dr. Lee. When can kids under 5 get their COVID-19 vaccine?
So the short answer is we do not yet know. But hot off the presses, Moderna did submit an application for emergency use authorization to the FDA. So now it's just a matter of when will that emergency use authorization be approved. And I'm sure we are all like impatiently waiting to hear that news. But in short answer, we don't know, but now we can say it will probably be by the end of the year. It may even be by the summer. We'll just have to see. It depends on, what this approval process looks like. And, Pfizer's been working on it too, but they have not yet submitted their application, but probably soon.
Can you explain for me, because this is just something I wonder too, the difference between adults and then you see children, like I'll see parents that have on their masks and children do not. And so can you just explain why that is for people?
Yeah.
That would be super helpful.
Absolutely. So for children that are 2 and under, or other children who cannot navigate their own mask well, we don't recommend a mask. It's important to be able to breathe easily. Children have very small noses, small nasal passageways. And so now we're weighing the risk and the benefit of wearing the mask. And it's just safer for those younger children and maybe even some older children who cannot remove and put their masks on well to just not wear a mask at all. So that is why you may see that. And many schools are changing their mask mandate, as we've been hearing, and not requiring masks because, the infection rates are lower and they feel like it's a safer time, for them to be able to do that. We do know, even though that children do get sick from COVID-19, they can get very sick, they can be hospitalized for COVID-19. It doesn't happen at the rates that it happens in adults. But we all want to be mindful. As I said earlier, we're kind of all in this together and we all get COVID from someone else. So, we want to, as much as possible, keep our children from getting COVID-19 to protect their family members, parents, grandparents, aunts, uncles, neighbors, whatever the case may be, babysitters. We're all spending time together. So it's important to keep everyone as healthy as possible. But having said that, you may not see the children with the mask.
No, that's a good point too, because I think people also forget that. And so I think it's really important to remind people. So they may think that themselves or their children, might not get very sick, but then they go to visit my mom, right? And then my mom gets very, very sick. So my mom personally, that happened to her. She got very, very sick. She has long COVID. She has had congestive heart failure. She's still suffering over a year later, right? And so people have to take that into consideration. Your risk exposure is, for you to, if you want to risk yourself, that's one thing, but that could also impact people who are more vulnerable, and they can become very, very sick. And so I think that's something we have to constantly remind people of, because I think you just don't think about it.
Yeah, absolutely.
So Dr. Smith Benjamin, we talked about, again, like people being, saying, things are changing all the time. So do you think that there's a need for vaccines that are going to be updated specifically to match, these emerging variants? And, is that possible? If so, how long will it take to develop?
Yeah, no, I remind everybody that every year the flu vaccine is a different vaccine. The epidemiologists study which strains of flu are happening in different areas depending on the season, and they track them and which ones are the most likely to come to the States during the fall, flu, and cold season, they add those to the vaccine, and then that's the vaccine that we get. So the only difference is that the flu is a seasonal virus at this time. And so it kind of comes and then the season's over and then the season goes away. With COVID right now, the pandemic is not quite really seasonal. We might have some ebbs and flows, but we're still having sort of continuous community spread all year round. So I assume and guess in the future that there might be one time where we're sort of tracking different strains from different parts of the country or world and sort of finding the ones that are the most likely to be maybe dangerous, the ones that are most likely to be infectious, and adding those into new vaccines. So taking that kind of information and data is something that has been done before. The nice thing about developing mRNA vaccines is that the mRNA is created and it's a little, letter by letter code, and it's easy to kind of put those different codes together to make a different protein. We just have to know kind of which proteins we need to make. So part of that's going to be getting a lot better at tracking these variants, which people already are doing a really great job of, and figuring out which ones are going to be the next one. So I'm hoping that happens soon. I'm hoping that we start to create new ones. The most important part is to anticipate. So having a vaccination against the Omicron variant might not be as helpful as maybe the new BA.2 variant or a future variant that we see. So it's kind of determining which variants are the most important and looking to the future, which can be the more difficult and confusing part. So I'm hoping that will start happening soon, but I can't really guess exactly when.
Thank you. This is a question that I hear often, Dr. Lee. Young people in particular, maybe they're athletic, right? And so they've already had COVID-19. Do they really need to get the vaccine? And then again, here comes the other big thing for parents, right? Myocarditis, right? Like, is that they're very worried about that. So can you speak a little bit to that?
Absolutely. So we do recommend that you get the vaccine if you've had the COVID-19 infection. We know that we have much better protection against repeat infections if you've had the vaccine. When you get COVID-19 infection, the level of antibody and protection that you have against reinfection really is dependent upon the variant you had, how severe your case was, and there's really no way of knowing that from one individual to the next individual, whereas we know with the vaccine the level of protection that you will have. And just like someone who's had the vaccine gets a booster, that same concept exists if you've had the infection and then get the vaccine. It is safe. It is recommended. It will provide you longer protection. And then to the question about the myocarditis, which is something that we've seen primarily in teen males and young adult males. It's an infection in the muscle of the heart that is a rare side effect of the COVID-19 vaccine. And I want to stress that it is rare. And if these same people get COVID-19 infection, they are far more likely to get myocarditis than with the vaccine. And all of the cases of myocarditis that we've seen after a vaccine have been mild and treatable. So the benefit of getting the vaccine still far outweighs not getting the vaccine, even though there is that very, very rare chance of myocarditis in those younger males.
Thank you. And that I know I hear that come up a lot. And so thank you for speaking to that. Dr. Smith-Benjamin, can people get the COVID-19 vaccine or the booster shot along with other vaccines, like at the same time? So yeah. Can they get the flu shot and the vaccine?
Definitely. Yes. I think initially we wanted to space vaccines out because we wanted to guarantee that there was a very strong response to the COVID vaccination, because we wanted to make sure people were protected. And over time, when we had more time to do studies, the studies have shown that one study looked at giving both the flu shot and the COVID vaccination to people at the same time. There were no increased adverse effects. There were no negative side effects that were different than what somebody might get from either of the vaccines. And both of them had enough antibodies and protection that it was very effective. So a lot of vaccines that children get, actually, they can get combination vaccines that might have 2 to 3 vaccines within the one shot. So it happens a lot, and it's safe and effective.
Thank you. All right, so I want to ask one final question before we go to the Q&A questions. And I'm going to ask this of both of you, and then I'll answer it myself as well. So what would you say currently to people who are hesitant to getting the COVID-19 vaccine? So I'll start with you, Dr. Lee.
Okay, so please talk to your healthcare providers, and whatever questions or concerns that you have, just simply ask. It doesn't matter how it sounds. It doesn't matter where your information came from. Just put it out there. Whatever is holding you back, whatever question that you might have, so that your healthcare provider can have an opportunity to talk to you. And there are many reliable resources out there. And I want to say reliable because there's so much information on the internet, on YouTube, on social media that is not always factual. But the CDC, which is our Centers for Disease and Control, are reliable. Your local health department is reliable. If you are a parent of a child, talk to your school nurse. And even if they can't answer your question, they can point you in the right direction. Just talk to a reliable healthcare provider about whatever your concern is. And then in the end, I would strongly encourage you to get the vaccine. It is the best way to protect you, your family, your friends, your community, and everyone that you interact with.
Thank you. Dr. Smith-Benjamin?
Yeah, so I would say I definitely echo Dr. Lee's point of talking to your healthcare provider, finding somebody, a healthcare provider that you trust, and telling them your questions and telling them your concerns. I really like when people come to me with their worries and issues regarding COVID vaccination, so we can kind of pick them apart and address them. There's a lot of reasons why people are hesitant about vaccination, about the healthcare system, about the politicization of the scientific process that happened, and that it feels a little new still. But I always assure people that these vaccines are safe. We have seen them almost over 2 years, about 1.5 years. And we have seen many people who have gone on and volunteered to get vaccinated, who volunteered to get vaccinated first in their clinic, so that other people kind of see what happened, and see that they're safe and effective in lots of different people, right? In children and pregnant people and adults. So all the studies have been really positive, which is really amazing. And actually, this vaccine is one of the most effective vaccines that we have seen in a very long time, which is really wonderful. So we have a lot of information to support that. We have a lot of information that people can go to if they have questions. And I just do like to acknowledge that there's a lot of information everywhere, and we do have to sort of be discerning people where we're going to decide what information we're going to take as real and as truth and factual, and what information we're going to discredit or disprove ourselves. I like to tell people that there's sort of a Sasquatch effect, right? People say, oh, Sasquatch doesn't exist. And then people say, well, how do you know? Like, you haven't seen him, or how can you really prove without a doubt that Sasquatch does not exist? And it's very easy to sometimes get caught in these cycles where how can you prove 100% without a doubt that this potential cause that somebody I saw on Facebook had after getting a COVID vaccine is really related? And it can be really tough and scary. And so talking through things is sort of the best way to sort of approach it. And then the last thing I do get a lot from people is that this mRNA vaccine is new. Like, I've never had an mRNA vaccine before. Like, this sounds really scary. And that actually mRNA, which is a small sort of protein messenger that gets easily broken down in your body, does not get stored in your body, is something that's been studied for a while. And actually, one of the people who helped really catapult this technology is somebody who worked at the University of Pennsylvania, so within Philadelphia, and found out how to make it safe and effective in people in 2005. So we've been studying this technology in people since about 2005. So even though this is the first time that as a population, we're really seeing this technology be used, it's been studied and we've found that it's to be safe and effective. So COVID vaccines are just one of the first successful mRNA treatments, but there's going to be a lot following after too. So hopefully everybody will start to feel a little bit more reassured. They know people who've been vaccinated. They can talk to people who've been vaccinated to get their thoughts and then hopefully kind of think about getting vaccinated themselves. And then I guess my final thing I would like to tell people is that it's never wrong to admit that you're wrong, or it's never wrong to change your mind. I sometimes have my beliefs that I hold steadfast to, and then I get more information and I have to kind of change my mind. And there's nothing wrong with that. That's kind of what, science is. You have a theory, you get information, and we might have to change something. So just because before you felt like you did not want to be vaccinated, or you're somebody who's not going to get vaccinated, doesn't mean that has to define you.
Thank you. Both awesome answers, both from doctors. So they're speaking from, the science world, right? They're bringing that lived experience. I'm going to speak to you from a personal experience, right? As I mentioned, my mom, prior to, she was right there, right? COVID, she was in that, if you remember very early on, there was like a long waiting list for vaccines. She was in that list to get the vaccine, and someone exposed her to COVID. She wasn't going out very often. She was doing everything she should be doing or could be doing at the time, and she just missed the cutoff and she got COVID, and it was life-changing for her. She went into COVID very independent, self-reliant, and she can no longer drive. She has been in the hospital, congestive heart failure. And so today, still over a year later, she is suffering from the impacts of COVID. And so what I would say to people is, even if you are hesitant, please, please, please be open to listening, because it's not just you and your life that's at risk. It is people like my mom, who I know you all have moms and moms who may suffer greatly and may not even survive getting exposed to COVID. And so it's so important that we're not just thinking about it from our own personal perspective, but that we're thinking about people we love, because their lives are at risk. And so many people have lost loved ones. Me personally, I'm grateful to still have my mom, but she's not the same mom that I had before COVID, and she will never be. So I would just like to open that up to people, because, it's heartbreaking to take someone who was completely independent and now have to figure out how she can live in a space where she has to depend on people to pretty much take her everywhere. And she still really can't be around anyone, because she cannot take another exposure to COVID, right? She would just not survive it likely. So just take that away. And even if you're thinking, I don't want to hear anything about it, listen, open yourselves up and just be open to listening and really trying to, listen to the science, because it could save your loved one's life. And so that is, again, my personal plea. And so I respect everybody's feelings, but I just, most people don't, coming from a personal experience like that, I think maybe that will hopefully help some people change their mind and just be open to considering it. So, all right. So now we're going to move on. We did have a couple of Q&A questions, so I'm going to go to them. We had one from David Schrack, and so I'll read that. And then I will let you guys decide who wants to answer the question, whoever is best equipped. I have received 2 doses and a booster of the Moderna vaccine. I received the booster in November 2021. My primary care doctor told me that the newer Moderna booster may be available in the near future. Should I wait for the release of this newer formula or get the one currently available? I am a male over 65. And he said, thank you. So whoever wants to take that.
Yeah, I'd be happy to answer that. I think actually it was Dr. Peter Hotez, who is epidemiologist and immunology professor, I believe, who has been really big in the vaccine world during the pandemic, said that the most effective vaccine is the one that goes into your arm at that time. And it's tough because, oh, there might just be something that's coming up around the corner that might be even better, but the vaccine that you have available, if you're eligible, like your physician may have recommended, is probably the most effective one now. There's always going to be chances to get the other newer vaccine later. And as we've seen, there hasn't really been any side effects with people getting boosters too close together or a slightly larger dose, given the fact that it might be with a different sort of variant and different sort of mRNA technology, but probably the one that you have available to you now will be effective. And then as the emergency use authorization, the studies come out and things are approved and created and shipped out to pharmacies, it will probably be time for you to get your next booster anyways.
Thank you. All right. Here's another one. And I don't know if we can actually answer this or even if it, if there's an answer at this point, but it is something that I think not just applies to COVID. I think it applies to a lot of things when it comes to just documentation, right, of health occurrences. So like when you go from one doctor to the next. So I have seen in many instances that people who wish to get a second shot or booster are being turned away because they're not able to provide the vaccine card initially given to them. This person is located in Georgia, so shout out to Georgia. And our vaccine teams are able to access Georgia registry to see everyone's health information that has been entered into the system. However, they're not entirely dependable. Even major pharmacies like CVS and Walgreens are seemingly not entering the record of vaccines being given. How can we overcome this obstacle and stop turning people away who cannot provide a previous vaccination record? This person says they've seen easily over 100 people turned away when this situation arises. And I think this speaks to the larger, I know when the healthcare law passed, that was one of the elements of it was this, keeping this record database that was open to everyone. And I do think right now as a country, we're kind of not meeting that because you go to one doctor and they have no idea what happened to you at the last doctor. So I don't know if you can really answer to that or if either of you want to speak to it, but I think it's important to acknowledge that this is something that still needs to be addressed across the board in the medical field.
And I can speak to it. And of course, we don't live in a perfect world. And so we want to help as many people as we can, but in a safe way as well. So Dr. Smith-Benjamin just mentioned, sometimes if the vaccine interval or the time in between your doses isn't quite perfect, it's okay. But at the same time, we want to be smart with this and we want to be careful with each person's lives. And so in an ideal world, there is a central registry where you can access information. We don't have a national registry. In Pennsylvania, we do have a state registry. I think you mentioned that this person who submitted the question was from Georgia. And each state, each area is doing it a little bit different, which does make it hard to have the information available universally. But many of us as healthcare providers, we do have access to that registry, but that information is only as accurate as the people who send it. So if the organization or place where you got your vaccine has not yet entered that information, some organizations are doing a little bit quicker than others, that can, prohibit us from having the information that we need. And so it is important to have some kind of documentation because, as we mentioned, the number of vaccines that you get are dependent on a lot of different things, your age, which vaccine you got, when you got it. And so we want to kind of balance giving you the protection that you need, but also doing it in a safe way. There is a reason why there are recommendations about these vaccines and when they should be given and how much space should be given in between and how many we should give. And so we want to try to adhere to that as much as possible. And so what I always recommend to my patients is just go back to where you got the vaccine. You don't actually have to have the actual vaccine card. It's just about having some type of documentation of when and what type of vaccine that you got, so that we can, meet the criteria and adhere to the guidelines as much as possible.
Thank you. Thank you so much, because I do think that is important. And I do think that's something we have to continually try to, get better on, because I think it impacts so many people. So we are at time. And I just want to thank everyone that attended tonight. I want to thank everyone who participated. On behalf of the NAACP, I want to thank Giselle, who is our health committee chair, and she worked so hard to make sure our community is informed. I also want to thank Monco. Shout out to Beth Till and Kelly, who are always working with us to make sure that we're able to provide these types of conversations virtually for our community and just lots of communities in general. And really, again, going back to that meeting where people were, where they are. And then for Dr. Lee and Dr. Smith-Benjamin, it's been a pleasure speaking with you. Thank you so much for all of your information and taking the time to talk with us tonight. Again, hearing from, trusted members of our community that are also in the medical field, I think is critically important to sometimes breaking down those walls of mistrust and just opening people up to the, having a willingness to at least listen and be more, just consider more, whether or not they will be open to getting the vaccine. So thank you all so much. I hope you all have a great evening. And I'll just close out with that. Thank you.
Thank you for having us tonight.
Yes, thank you so much.